Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to take you through some exercises for those who have been diagnosed with golfer's elbow, medial epicondylitis. There's a bunch of different names for it. Those are two of the most popular ones. When you're discussing anything going on, whether it's tennis elbow, golfer's elbow, things going on at the elbow, you have to understand is that it's primarily coming from the shoulder. So one of the exercises we're going to go through today is actually going to be strengthening your shoulder. And usually the overuse that comes from your elbow is either a dysfunction of the shoulder or the wrist. It's usually a combination of both. Coming in to see us, we will be able to diagnose exactly where it's coming from. So don't be alarmed when you see an exercise later on focusing on the shoulder. If you're not focusing on the shoulder and you're just focusing on treating the elbow, you're not going to get better. The symptoms may go away, but they will come back inevitably because you didn't treat the problem, you treated the symptoms. So we're going to go through two stretches and then a strengthening exercise. So the first stretch we're going to do is just a prayer stretch. So you're going to put your hands together and you're going to push them down. Okay, keeping your elbows out, you're going to push them down as far as you can. You want to keep the palms together. So if you start to have your palms come out, stop the stretch, okay? The idea is that you're going to feel a nice gentle stretch. If you feel pain, you should discontinue doing this exercise. You want to hold this 30 seconds and you're going to do 6 of those. You can do these numerous times throughout the day. It's just a gentle stretch, so there really is no limitation on how many times you can do it. The next stretch is going to be a stretch that you're probably going to feel right in that mass right there where you have the pain. Many people with golfer's elbow will report a lot of point tenderness. There's one point that really, really hurts. This will stretch a lot of the tissue surrounding that one point that really, really hurts. So all you're going to do is just hold your arm out straight, palm facing up, point your fingers down towards the ground, and then you're just going to gently pull your fingers back. Because we have a healthy specimen here, he's able to really pull his fingers back. Some people, right off the bat, are only able to pull back just a little bit. That's okay. You don't want to cause pain with this stretch. You want to feel a nice, gentle stretch. If this causes numbness or tingling, you want to stop doing this and consult your medical professional immediately. However, if it's just feel a nice, gentle stretch, hold back 30 seconds, 6 times. Again, it's a stretch, so you can go through the day and do these a couple of times. It's not going to hurt anything. The final exercise we're going to do is the shoulder exercise. This is going to help strengthen your rotator cuff. A lot of people who have epicondylitis, golfer's elbow, tennis elbow, have a weak rotator cuff, meaning you're not able to stabilize your arm, so you're trying and you're overusing muscles in your elbow and your wrist and your forearm in order to do that. So to do this, you want to lay on your side with the injured arm up. So you want to lay on the side, you want to lay on your side that's not injured. You're going to keep your elbow next to your body. If your elbow comes up during this exercise, you're doing it wrong. And all you're going to do is rotate your arm up as far as it'll go and then lower down. This should cause no pain. You should not feel like your elbow is working. This is a shoulder exercise. So you want to go nice and easy, rotating your arm up and down, nice and slow. If this is easy and you're able to do 30 of these, no problem, and you're taking it nice and slow, put a soup can in your hand. Those are, generally 1 to 2 pounds, depending on which soup you have, and then do 30 that way. Nice and easy, okay? You want to do these, again, since it's body weight or it's a soup can, you can do these every day. The idea is that you're going to get your rotator cuff stronger, which is going to take some of the pressure off the elbow and allow it to not be used in that overuse situation. If you have any questions, please give us a call at 215-997-9898 or visit us on the web at www.totalperformancept.com.